So.
I realized I was mute. Hi, how are you?
I'm fine. Hi, Pat. Hi, Dr. Fernandez. Thanks for joining.
Hi, I'm so happy to be here. Thank you for having us.
Of course.
Afternoon, everyone, or good evening.
Hi, Xavier.
Hi.
Hi, Sandra. I see that you have your hand raised. Do you have anything to say before the committee meeting begins?
No, I'm just anxious to hear. I've been getting a lot of emails and just want to hear what's going on more.
All right. Okay. Thank you so much for attending.
Should I unmute myself?
Sure, I can
Should I?
mute you. I can mute you.
Okay, thank you.
You're welcome. Hi, thank you so much, everyone. This is Marlene. I'm the Community Associate for CB11. We're just waiting on our chair to join, the chair of the committee, Nye Whitaker, to join. And for the committee to achieve happens, the meeting will begin. Thanks for your patience.
Good evening, everyone. Hey, Marlene, how are you?
Hi, Nye. You just need one more for quorum, and then you
Thank
can
you
be.
so much. I'm going to give it another few minutes, everyone, if that's okay. And if you're not myself or Marlene, if you could just put yourself on mute, there's some background noise. Thank you. I'm going to go on mute for one more moment. Marlene, if you could just let me know when we have quorum.
Sure, no problem.
Yeah.
Eva just joined. Nye, you have quorum.
Awesome. Welcome, everyone. So it is exactly, it looks like 6:02 on my end. I am going to give it one more minute. I just want to check in. Marlene, are all of our speakers here? I don't know that I'm seeing everybody.
Sure. Right now, we just have CCHP, Michelle, and Dr. Fernandez.
Okay.
We're still waiting on folks from NIAM.
Okay. I'm going to give them one more minute.
Mhm.
Thank you all for your patience. This is your last chance to run to the restroom or grab your water. This is possibly going to be a nice, robust conversation. So take advantage of this last minute to get ready. Marlene, do you want to drop them an email just in case? I know I saw their email earlier, so I don't know if maybe they are thinking
Shania
about.
from NIAM, Shania Taylor just joined.
Okay, awesome. Great. Then I think we're all set to get started. I'm going to ask Marlene if you can start with your housekeeping, please.
Sure. Good evening, everyone. Thank you for joining Manhattan Community Board 11's Human Services Committee meeting. Until further notice, all meetings of Manhattan Community Board 11 will be conducted by video conference. Links to register to attend the video conferences for each of our respective committee meetings will be published on the meetings calendar on our website. For those calling in, the website is www.cb11m.org. To avoid crosstalk and help the meeting run effectively, panelists and attendees are asked to keep their microphones on mute when they are not speaking. It is also helpful to utilize headphones. Those participating by phone can dial *6 to unmute, and that is also how you would mute your line. If you wish to share a question or comment, you may do so by utilizing the raise hands function. Our staff, myself, will monitor to ensure that hands are recognized in turn. Those participating by phone can dial *9 to raise their hand. Committee members will be called on first, then attendees. Please keep your questions or comments brief. I'm going to turn it back over to you, Nye.
Thank you, everyone. I'm just scrolling to make sure I see everybody here. Can everyone hear me and see me okay? Great, thank you so much. So I would like to call the meeting to order. What time is it, Marlene?
It is 6:05.
Great, so we're gonna call the meeting to order at 6:05. And I'd like to be able to adopt the agenda, so I need a motion to do so. Marlene, do you wanna do a roll call of attendance first, or do you wanna do that as part of the adoption? How would you like to proceed?
You could, I'll call the roll after someone seconds the motion for you.
Thank you. So if someone could please make a motion to adopt the agenda?
I move to adopt the agenda. This is Robin.
Great. I recognize Robin as the
I
first,
second.
and I recognize Pat Martin as the second. I'm going to turn it over to Marlene to then do the roll call.
Sure. Rakeem Brooks,
Yes.
Eva Chan. Eva?
Yes.
Thank you. I know you seconded, but I also call on you. Patricia Martin.
Here.
Thank you. Jennifer Meyer. Jennifer Meyer.
Yes.
Thanks. It's okay. Xavier Santiago.
Yes.
Thank you. Isaac Scott.
Yeah.
Thanks. Robin Strachan.
Here.
I know you made it, but I still have to call. Nye Whitaker.
No problem.
Yes, here.
Okay, it carries Nye.
Great, wonderful. So I'm going to go ahead and get us started. Just pulling up the agenda on my phone so that I can see it more closely. I'm getting to that age where I have to do the glasses on and the glasses off, as I've mentioned before, so bear with me. So informational updates. I'm going to just start with a quick update that tomorrow the New York Health and Hospitals Test and Trace team will be hosting a Get Tested Tuesday Day of Action. As part of those activities, there was an email that went out earlier, I believe from Angel. They will be doing 2 sites in our direct area, East 125th Street in Lexington at the 6 train, and 1775 houses on 126 between Park and Lexington, with a free mass distribution, as well as palm cards and other information as to whereby our residents can get tested, many of which are free or low cost across our community in partnerships with sites like Metropolitan, Harlem Hospital, and others. And then working their way west, they will also be at, just for informational purposes, the 125th and Lenox site where the 2-3 train is, and the Harlem State Office building across our particular Harlem area. There will also be sites down in Chinatown, up in Washington Heights, and just across the entirety of Manhattan. I know the mayor was doing an announcement today about it, but I also just wanted to make you aware. I know that they're also looking for volunteers. So if you are interested, you're welcome to email me directly and I can pass the information along. This is based on Lorraine, who presented to us previously from Test and Trace. And I wanted to make sure that that was on everybody's radar. They're starting at 8 a.m. On 125th Street on the east side. So that'll be from 8 to 10, both at the 125th and Lexington 456 stop. And then at 1775 houses on 126 between Lex and Park, and then moving their way west from 11 to 1. And then again, the other sites south and north of us for the rest of the afternoon and well into the evening. So I want to open it up for any other informational updates from our committee members. And I will ask if you could raise your hand. Marlene, I see Xavier. I just want to make sure I'm not missing anyone else. Great. Okay, Xavier.
Hi. 2 things real quick. There is some progress with Oasis. They were able to, there was a meeting with the state agency and several of our state elected reps. They've expressed the importance of what's happening here in our community and gotten them to be willing to participate in the task force that's going on 125th Street, headed up by Diana Ayala's office, that was started some time ago. And we are basically, we'll have more updates as they come along, but it was expressed to them how they intersect with the city agencies and the city level. So that's the update we have. Stay tuned for more information. On a final bit, I'm sure you hopefully by now have received the arrangements for the wake for Edwin Marcial, who was a community board member who passed last week. Many of us knew him for decades, and he was pivotal for cultural engagement here. And so please, if you're going to pay your respects, obviously wear your mask. And the information was sent out via email. If you haven't received it, just pop me a little private message and I'll send it to you. And then the last bit is that I sent an email with information about COVID and resources, but also to dealing with NYC Well. One of the things that many people were finding are neglecting are their personal mental and emotional well-being. People are taxed, they're stressed, it's showing in fissures. And if you need time please let us know, your committee chair know, let other people know. If you need to even give me a call personally, even though we all serve and know most of each other in a professional capacity, we can get you resources and we will get through this together, but there's obviously going to be some holdover. And for those that were at other committee meetings where I was expressing this, I cannot tell you enough that if you are not at 100%, you're not going to be able to serve yourself, your family, and your community. So please pay attention to that and do personal check-ins as well as checking in on others. So thank you very much, Nye. Good to see everyone.
Xavier, I just wanted to double check. FYI, I will also write you separately, but I did not get the announcement. And I'm just curious, is there anything that CB11 is doing that our committee should know in order to support his family or recognize our longtime neighbor, Edwin Marcial?
We will be providing a floral arrangement that was just recently ordered. It's on behalf of all the board members. And I will pop the information. I'll send it out to our committee in case you didn't get it for those that desire to attend this Wednesday. So thank you very much for asking.
Thank you. I'm going to recognize Robin next. Robin, you're on mute.
I just said a whole paragraph. No, only kidding. Searching Care is the organization I represent. We serve seniors 60 plus in the community and greater New York area. Mental health is something that we are approaching with a variety of groups telephonically and virtually. We have an advocacy 101 workshop coming up this Thursday. We also have a meditation Monday. We have other groups. If you know of seniors in need, my number is 212-289-5300. Thank you.
Thank you, Robin. Are there any other informational updates or I kind of usually combine these announcements from our committee members? If you could please raise your hand so that you can be recognized. Okay. I'm going to add one more thing just because Xavier did mention about the task force. I did receive an email just before this meeting started. I don't know if anyone's here from Councilmember Ayala's office, but that the 125th Street task force that is working in conjunction with the mayor's office, so the 125th Street corridor task force will be meeting on December 15th at 1 p.m. Additional information will follow when that information comes. I know Xavier and I will be participating. We will also make sure that the office is aware of that and that we bring an update to our January meeting, since that meeting will take place after this one. We may also hear more about it at the full board meeting. Xavier, please.
Yes, if you have any questions, please send, I'm going to drop my email in the chat and I do the same. If you have any questions about that or things that you want us to raise, which we'll get into further in the latter part of the agenda. I don't want to hold up the show, but you can send it to us and we'll forward it to everyone there. Okay.
Yes, Xavier and I, just FYI, will be attending. And so if there's any comments or concerns, please feel free to reach out to us. And we will be representing our committee, our committee and also the board on that larger task force. I'm putting my personal email here so that you all have it. Marlene, I don't see any other raised hands from the committee members. Can we now just double check if there's any announcements or informational updates from the public?
I don't see any raised hands. Oh, one person just raised their hand.
Oh, Noel. Hello, Noel.
You can speak, Noel.
Hi, can you hear me now?
Yes.
Yes.
Hi, everyone. Noel Alisea from Metropolitan Hospital, your local community public hospital. Just a reminder that we continue to provide COVID testing at our annex on 97th Street between 1st and 2nd. Our lines are still, the demand for testing is still high, not as high as the week before Thanksgiving. We think that was related to people looking to travel. But we still have testing available 9 a.m. to 3:30 p.m. 7 days a week. That's walk-in only. Results are available usually 24 to 48 hours. In addition to that, please remind folks that if they have medical visits that they put off, diagnostic screenings, etc., to please schedule those. People have gone for months and months without seeing their providers for routine care, and you can let folks that know that we're available if they need a provider. Otherwise, take care and happy holidays.
Thank you, Noel. Is there anybody else that I
I
may?
don't see anyone.
Okay, great. Then I believe the next section is to move into our presentations for this evening. As we mentioned when I came on board as chair in September, we would like to invite service providers across our district to give us updates to know how we can partner with them and also what services that they provide that our community members can access. Is Michelle, is it Godot? Or
Godot.
Godot. Okay,
Yeah.
thank you, Michelle. I appreciate it. So we have Michelle from the Center for Comprehensive Health Practice. Please, the floor is yours, Michelle.
Great. So thanks, everyone. So I'm here with also Dr. Fernandez. So she's our Chief Medical Officer. And a little bit about kind of give you a rundown of our services, sort of how long we've been in the communities, the patients that we serve, and things like that, and a little bit talk about also, our responses to COVID since the outbreak began. So I'm going to go ahead and just share my screen here. Okay. Great. So as I said, we're with the Center for Comprehensive Health Practice, and so we are located. We've been in East Harlem since 1960. We're actually inside Metropolitan Hospital Center. We're not affiliated with them. We just, sometimes get to coordinate with them, care and things like that. And our founder was Dr. Richard Brotman, and he was pretty innovative in integrative medicine. We hear that word used a lot now, but he actually was one of the founders of it back in the 70s, where he combined primary care, mental health, and substance use treatment all in one. So just to kind of give you a rundown, our mission statement is, we provide accessible community-based treatment that integrates primary health care with substance use and behavioral health services for all children, adolescents, adults, and families. So our approach, it creates what we say is a lasting healthcare partnership between patients, families, and the professionals too. And these are just some of our values that, are really important and core to our work, which you'll kind of see as we talk a little bit more about the services that we provide and, who our patients are. So we're really emphasizing the importance of family and family-focused care, seeing that when you can get a whole family in for treatment, it changes if you just, as opposed to just treating one part of the family. All of our services are patient-centered. We do substance use treatment. And with that, when we create treatment plans, the patients are very involved with that as well. The integration of care, which is, having all these services under one roof. And, understanding, some of the negative experiences that a lot of our patients have had in the past, compassion is really important, especially when dealing with mental health, with substance use, and even, in some issues with primary care and chronic illnesses. And then, the importance of community with all this. I mean, we are only, just our clinic, and really the importance of valuing partnerships and working together. So this is just so, as I said, we've been here since 1960, but to sort of see what we've been doing and our involvement, really in East Harlem. A lot of people, probably if I took a tally here of how many people heard of us, not many have. We are small, but we've been here for a long time. And so for most of our patients that come through, it's not necessarily referrals. It's actually more word of mouth, which I think is more of a testament to the work that we do, that people, our patients feel comfortable and want to, tell other family members and other friends where to access care, as opposed to just professionals referring to us. So quickly, just to go over our timeline. So as I said, we started in 1960. We actually began, it was a collaboration with the New York Medical College and Dr. Richard Brotman. And in fact, in 1960, Dr. Brotman and CCHP actually helped establish Metropolitan Hospital as one of the first federally funded community health centers. So it really shows our roots grounded within East Harlem with Metropolitan, and also with also mental health services and the need for that in East Harlem, going back to the 60s. By the mid 70s, like I said, we were one kind of a pioneer for integration. So we integrated primary care into our substance use treatment. And then in 1976, we created PAM. So at the time, especially seeing what was happening in East Harlem, was seeing that there was a fair number of pregnant women, mothers who were dealing with opiate addiction, and sort of understanding that what their needs were are very different than the needs of other individuals who are dealing with opiate addiction. So we created, and we actually were one of the first in the country to offer methadone treatment and create more of a female focus, family focus way of treating opiate addiction. And in fact, our founder, I think in 1980, spoke in front of Congress on the need for this type of work and has some published work on this as well. So then, a year later, we became licensed. I think this is actually when Oasis kind of was formed, but we were officially licensed under Oasis. So with our, for our services. And then in 1990, I think before this, we were around 101st Street. And in 1990, we moved our methadone clinic into Metropolitan Hospital. And now we're that service is on the 12th floor of the mental health wing. And in 2001, seeing the overlap of HIV within opioid use, we incorporated HIV treatment within and prevention into our model of care as well. And then in 2006, we moved all of our services into Metropolitan Hospital. So now we have 2 floors that we currently work on. And then in 2017, we became recognized as a patient-centered medical home. So that's through the National Center for Quality Assurance. And that's essentially meeting a certain number of regulations, standards within not just care, face-to-face care, but also with our electronic medical records, confidentiality, all of that. And just to sort of see, who our staff is and what sort of makes CCHP. So we're heavily, most of our staff is actually just direct service. So you'll see that, we have 13 nurses and medical assistants that work with us. Our doctors and nurse practitioners, we have 6. We have 2 psychiatrists. One of them actually sees children. Our counselors, we have 20 counselors on staff. And then our front desk is 6. We have a small administration, finance, HR team. And actually 30% of all of our staff speak Spanish, knowing how important it is to, be able to speak for some of our patients. English is a second language and more complicated and harder for them. So we want to make sure that when accessing services, they speak their first language. And so this is, to see, why are we important? Why is East Harlem, why we're here? 50% of our patients are from East Harlem. And then another 22 are from, neighboring communities. So that would be Central Harlem, maybe Washington Heights, Upper East Side, and Upper West Side as well. And then a lot of our patients also come from the South Bronx. And in this other category, we actually have patients that travel from really far sometimes to see us. We'll have maybe somebody who started out from East Harlem, and then they'll come from Staten Island or Westchester. We even have we have a patient enrolled in HIV care who comes from China once a year to see our HIV specialist. So just a testament also to show, how far people will travel with accessing care with our physicians and our team. And just, as I say, we're family focused. So we serve all ages. And so with our substance use treatment, which we'll talk a little more about that is specifically ages 18 and above, but all of our other services are accessible to anybody at any age. So, our pediatrics, we have about 20% that are under 18. And then we have a significant amount as well that are, older adults, but, around 25, 30%. So it really just shows the range of all the services and who we're treating here. And also our patients, rely on public benefits. And what I think is really important is having a choice for patients, that if you're on Medicaid, you're often, only have a certain amount of providers available to you, but when you want their options to be important to them and that they feel heard by their providers, even though if they can't afford to see a private provider. So you'll see that 60% are using Medicaid, 20% are Medicare, and just 20% are either private insurance or self-pay. And I'm going to pass it on to Dr. Fernandez. She's going to talk a little bit about the services that we provide.
Again, thank you for having us. So I currently am the Chief Medical Officer at CCHP. When I learned that I had the opportunity to tell you all about what we do and who we are, I was very excited because I've actually been working there since 2007. I still am a practicing pediatrician there at the clinic. So a lot of my time actually is very clinically based, which I really, really enjoy. So just to tell you a little bit about what we do. So these are the four main areas that we work on at TCHP. And again, the founder had this vision for, let me build a place that families, some of them with little to no resources, can get everything that they needed under one roof, right? And that, you go to a major hospital, and yes, they have mental health, and yes, they have substance use, and yes, they have primary care, but sometimes you have to go to the West Wing or the East Wing or a different building. And it's great that we're actually co-located in one facility. So in terms of, I'll speak to each of these in different slides just to give you a more detailed view of everything. Next slide. All right, so for primary care, so we really try to focus on prevention and early detection of illness. Of course, some of our patients present to us already with some chronic illnesses, but actually being able to provide them, one-to-one patient education, good care management, we're able to, we hope and we do, prevent them from getting sicker sooner or having to end up in the ER and things like that. So the services that we have for primary care are adult medicine, pediatrics, which is what I do. We do have HIV and AIDS treatment. We do offer pre-exposure prophylaxis for HIV. We have a hepatitis C treatment clinic, which has been very, very, very successful. We do provide diabetes management. We have a women's health clinic that provides breast exams, pap smears, family planning, and we do that every other Wednesday of the month. We also have a Reach Out and Read program, which I was very excited to actually launch. So I don't know if you guys have heard of Reach Out and Read of Greater New York, but basically it's an organization that promotes early literacy for children 6 months to 5 years of age. So they provide us with books at a subsidized cost. And then at every well visit, any child 6 months and older up until the age of 5 years gets a book given to them at the visit, which I find it amazing when the parents are actually reading with the child in the office. And even for those parents that don't know how to read and literacy is an issue, they're able to discuss the pictures and things like that with their children. So it's great for family time. We do have a lot of health education classes that we offer for diabetes, for high blood pressure, and for other chronic medical conditions. And then again, we do really focus on the big things that affect our patient population. And of course, everybody knows that, Upper East Side and the Bronx, asthma is a big thing, diabetes and hypertension management. Next slide. Okay, in terms of our substance use treatment is pretty diverse because we do get to provide care to a lot of patients. And I'll just speak a little bit about each of them quickly, because I know we're pressed for time. So the Family and Employment Services Program was started long time ago, and it's basically an outpatient substance use counseling program that provides counseling services to any patient that has an addiction, whether it be to alcohol, cocaine, heroin. But the important thing also too is that it also provides counseling services to those who have been impacted by a substance user in their life. And I kind of find it hard to believe that there is a person out there that hasn't been exposed, whether it's a friend, a brother, a sister, a mother, a father, an uncle, someone that's been exposed to substances, right? So a lot of the children that I see, some of them actually, they do need the extra support because as children present to the clinic in different ways when they've been exposed to, like just sometimes some of the things that happen that they've been experiencing with their families. And sometimes it presents as anxiety or depression, and we're able to provide counseling services for children as young as 5 years of age. Our extended care program is one of our methadone maintenance treatment programs. And this is for patients that have been struggling or coping with opiate addiction for many, many years. We do have an opioid overdose prevention program where we provide education and give naloxone kits to not only patients, but also community members that are wanting to, be active, for this epidemic of opiate addiction and like see if they could do something to prevent an overdose. We do offer buprenorphine as well, which is another medicated assisted treatment for opiate addiction. And then again, Michelle spoke about our PAM program. That program I think is really wonderful because as you know, addiction affects everyone in different ways, but to be a mom struggling or trying to raise a family, it just adds a different layer of uniqueness to that kind of treatment. And then we also have our maternal wraparound program, which is a program that was grant funded that helps provide intensive care management services for pregnant women and then 6 months after birth to help them get linked to OB care, childcare services if they need it, food pantries, anything, housing, anything that they need to give them support. All right, next slide. All right, in terms of behavioral health, we offer behavioral health in different ways. Again, there's individual counseling, there's group counseling, there's also play therapy. And as Michelle said, we do have psychiatry services and we have also child psychiatry as well. All right, our last program is what we call our ECDC program, our Early Childhood Development Program. And this is where parents that have children up to 3 years of age can enroll in, it's like parenting classes to help them learn the principles of childhood development and then gain kind of support as you're trying to raise your family. The classes are based on parents and children of the same age, so they can discuss their ongoing, concerns, and the children can have the classes together, which is really nice. And, in terms of free child care available to anyone receiving services at CCHP, unfortunately, because of the current pandemic, COVID, our playroom is closed, but we do have a fully staffed playroom where children waiting for their appointments or the parents that have children that don't have access to childcare and they need to have their therapy sessions in private and things like that can actually leave their children with staff members in a safe, and warm environment while they get the services that they need. Next slide.
So we're actually, I guess we're a little pressed for time, so I'm going to jump ahead for us. I sent the slides to Marlene, so because I guess there might be some questions. So I'm just going to quickly run through this, Marielle. I hope you don't mind, just because I think Naya's asking us to go a little quicker.
Oh, sorry.
That's okay. So just to sort of see, these are just sort of the.
Michelle, hang on 1 second. Can you go back a slide, please? I know you're skipping around.
Sure.
Go forward. There was one with numbers that had numbers about
this one?
Okay, I want to make sure you do that one. So you can go.
Okay, great. Yeah, so these are just the patients, the number of patients we serve every year at CCHP. So almost 3,000 patients altogether. And then you'll see about almost 2,500, we have primary care, 1,000 for substance use. And then we have an overlap, which as we talked about before this integration of care, that about 500 are accessing not just one service, but actually, they'll come for substance use treatment and primary care as well.
You can go back to that slide that was before this one as well.
Okay, so just to sort of see like all the services that we provide and to kind of to see it all on one slide is, again, like it's the importance of providing all of these different types of treatment and services all in one roof that anyone can access, and making it easier to get access to care as well. And let me just see, and just, this type of care has a lot of, types of outcomes. So we do multi-generational healthcare. So you have a child, you have a parent, a grandparent, that all can come in and access that. Because of our PAM program, we always have healthy birth outcomes for our babies. We work actually really closely with Metropolitan's OB program for the women who are pregnant. We distribute overdose prevention kits all over in East Harlem and other parts of New York City. We have really positive HIV treatment outcomes. So, 88% remain undetectable, which means that they're basically, it's impossible to detect HIV, or very low levels of detection. And while we do have, patients that come back, what we do actually think is when, I know that there's some concerns around, oversaturation of treatment programs, but addiction is what I like to say is kind of like Crohn's disease, where you sort of, it's not, you don't just come in and get treatment and leave. Unfortunately, it can sort of be, kind of comes in waves, ups and down, and flare-ups. But what we think is important, that if a patient leaves, that they always feel comfortable coming back to us. And then our services have shown a decrease in avoidable ER visits, which is a big goal right now of like New York State. So we're recognized by these different organizations. Just in terms of COVID response, we worked really close with the city and the state to be able to administer methadone and naloxone to patients, so they wouldn't have to come in. If they were in isolation hotels, we were working to give it to them. We started mailing out naloxone kits, so we mail out as many kits as people want for free, so they have access to them, especially while themselves or their family members or people they might know are staying in quarantine and isolation. We offered all of our services remotely. Within like a week, we were 90% remote while staying open if people needed access to our services as well. And these are just some of our funders, but I'll kind of, you can see that later. And, we've been involved and we continue to stay involved with the community and really want to make sure that, whatever concerns you guys have, that we can hear it. And if there's anything that you sort of feel like is missing, services that, as you can see, we provide a lot because we want to do what's ever available, whatever is necessary for the patients and the community we serve. But obviously, if there's anything else, please let us know. And these are just an event we did on 125th. I know you guys were talking about the corridor. We last summer spent all summer giving out naloxone kits every Wednesday with Uptown Grand Central, and then did this event with a couple of organizations. So sorry, I know I didn't realize we were pressed so much for time. So sorry to rush that in.
Okay. Usually our presentations are like 10 minutes and then we allow time for questions. And so if you were thinking of like a 15 or 20-minute window, that was inclusive of people being able to ask questions, and that's okay. I'm just happy, that you're here. One of our goals is to make sure that we bring in and elevate and emphasize our good community partners, because we also know that there's some people who are providing services here that are not, as good as others. And I know you guys have been here in the community for a very long time. One of the key questions, I'm going to take a little chair's privilege and ask the first questions, which is why I was on the numbers page. One of the things that we are very concerned about, and we know that some of these numbers are going to be in flux post-pandemic, right? We're going to see an influx of people who might be housing insecure or have health issues. Of those numbers you had on that slide, which is why I went right to that, do you know what percentage of the population of clients you serve are East Harlem residents or Harlem residents, so CB11, CB10 versus wider? I did love the story about, I wrote down the person who's coming from China to East Harlem. I feel like you should be writing an article about that. That's the kind of stuff we want to elevate. But I am always going to hold
of course,
to ask how many people from our neighborhood are you serving?
So we do it, I would say it's at minimum 50%. I had that in one of our other slides. So 50% are within East Harlem. And then about, I think I said something like 20% are other parts of Upper Manhattan area, and then also come from the South Bronx. So we serve this area primarily.
Right, that was the right answer. Thank you so much, Michelle. Thank you, Dr. Mary Ellie. I'm going to first, and everyone, I'm asking just to be brief with our questions. We are already at 6:40, and I know we have a beefy agenda on this Monday night, and I want to make sure we save time for our resolution that we need to get to in our new business. So first, anyone on the committee, if you could please raise your hand if you have a question. And I'm going to ask Marlene if you could highlight anyone that I'm not seeing.
I don't see any hands raised from the committee or attendees. Well,
Okay.
one person just raised their hand from the attendees, but not from the committee.
Okay. I am going to allow the person for the public to ask a question. And again, chair's prerogative, this needs to be a question, not commentary. I did write into the chat because there was a lot of comments that the question about the moratorium and resolution will not be discussed until its appropriate time on the agenda. So I'm going to allow, it looks like Ray has his hand raised. Ray, welcome. What's your question?
Can you hear me?
Yes, we can, sir.
Okay, thanks. Would you like to comment on the securing of specialty services to support the primary care function? I think, I think it's the forgotten part of the health system. And I'd be interested in your comments on getting those specialty services for your primary care patients.
Right, I'll speak to that. So we are actually part of a referral advisory group, which is a meeting that's held, I think it's the second Thursday of every month inside Metropolitan Hospital. And we have our nursing director attends that along with the heads of other major health systems. So like Mount Sinai, Metropolitan, Borinquen, they all meet and we basically refer patients to each other for subspecialty care. And because we're located inside Metropolitan, it makes it very easy for our patients to be referred into that system. Our nursing director also has a very good connection because she used to work at an HHC hospital in the past and has many connections within Metropolitan. So she basically has a good relationship with the referral office, and our patients, are put into their referral system in terms of like ENT or cardiology or things like that. Of course, insurance is the limitation. So some of our patients do have insurance that Metropolitan doesn't take, and then we have to refer them elsewhere. But it's very convenient that we're co-located inside a major hospital system. Did that answer your question?
Yeah, I'm the chair of that committee, but it's really not a system. It's a bit of a mess. And I'm trying to highlight everyone's attention to it who are thinking about the healthcare system. That really isn't a system. It's a mess that we all cope with. And I love you guys. You're terrific in that group. But there's a lot of different players servicing specialty services, and some of the queues, the wait, are just unconscionable.
It is true that the wait.
And so I just want to alert people that there is this system which seems to be hidden, not talked about, but it's extremely important. And we're just patching it with that referral advisory group.
Great. Thank you for elevating that.
Thank you.
And to be respectful of times, usually there's a question and answer. There's usually not a question, answer, comment.
Right.
So
Okay. Gotcha.
No, it's okay. I just want to be respectful of your time.
Sure.
And I would love to, I always say to everybody, you now are voluntold. So I would love to invite you, sir, to please come back to our January meetings. If your schedule permits, Marlene can follow up with you to help educate us about what some of those concerns are and some of those constraints and what that weight is. And let's have a discussion about what we may be able to do as a Health and Human Services Committee to convene people that can help us address this issue. And I thank you for bringing it to our attention.
Thank you.
Thank you, sir. So I don't see any other hand raised. So I'm going to thank Michelle and thank Dr. Fernandez. We have a copy of this presentation, so it will be available through CB11. I want to again just impress upon everyone that one of the things we are trying to do vis-a-vis this committee is to invite our good partners to the table so that we can elevate and promote their work. And be able to understand and have a better sense of what the service providers are here for social services, health services, et cetera, as we move forward to support the residents of CB11. So I'm going to transition. welcome to
Yeah.
drop your information from your last slide, which were your emails and information, maybe to the website. Please feel free to drop that into the chat so that anyone can pick it up. And again, the information will be available to our office, through our office. I am now going to switch and welcome our neighbors to the south, from the New York Academy of Medicine, which is near and dear to my heart. I used to have to walk by it every day as I went to school. And so I want to introduce, I believe Kimber Bogart is here with us, who has presented many a times to CB11, and we'll, I guess, get the presentation started. Kimber, we are just a little, want to make sure we're conscientious about time. We have you down on the agenda for 10 to 15 minutes, and then we will allow for some questions. Feel free to let us know, if you need more time or if it's a shorter presentation. I don't want you to feel constrained, but I do want to make sure we get to the new business.
Yeah, thanks, Nye. So just in order to preserve time, and if there's any Q&A, I'm just going to allot my time to Shania, who can take it away.
Thank you.
Shania, this is Marlene. Would you, are you sharing your screen? Do you need assistance with that, or are you fine?
I can share my screen.
Okay, great.
Can everybody see my screen?
Yes.
Okay. Thank you so much. So happy to be back with CB11 on this evening. I think it's been a few months, and so I'm happy to present here tonight to you all. And so this is just an update of the East Harlem Action Collaborative for Child Health and Wellbeing. And so for the sake of time, I know some of the members here are new and I haven't encountered you before, but I was trying to save time, so I didn't want to go back and sort of include a long slide presentation. But I will give sort of a brief overview of the collaborative and try and kind of speed through what we've done and where we are. So we started the program from an assets frame. And so these are the residents on the screen, and one of our frontline workers that we really have the pleasure of working with. And so really grateful for them. And when they're not here to present themselves, we always like to bring them in this space. And so we've worked with residents, I think, for a little under a year and a half now, to define issues within East Harlem, to identify assets. And I'd really say to identify assets first, and then to define issues. And they're reviewing data, they're setting goals, and they're proposing solutions. And overall, this is really a local resident-led initiative focused on health equity for children that, which you'll see as I go further in the presentation, has really blossomed into a wonderful sort of program of community leadership here in East Harlem. And so, like I said, we started with sort of our hopes and dreams for East Harlem, and we have honed in to narrow hopes and dreams, or the residents have honed in to narrow these hopes and dreams to 3 focus areas, which you see listed here. And it took quite some time to narrow our hopes and dreams down, but we wanted to be mindful of actually what would be feasible given the project duration. And so the last column is really our research phase. We've amplified resident leadership as it relates to research knowledge. And so residents have decided that they feel that children in East Harlem should be measured by safety, culture, agency, love, and equity, which we're calling SCALE. And residents have really, throughout this year and a half, honed in their understanding of measures and scales. They've now partnered with the NIAM team to really start locating and advising appropriate questionnaires to deliver to children in East Harlem and neighborhoods like East Harlem. And so many of us know that the surveys that our children are given help determine the resources that are available to them. And unfortunately, a lot of the surveys that are given to children within East Harlem and neighborhoods like East Harlem have been normed on white children. And so residents are now in the research and policy phase of the project. And so they're actually going to start building a policy agenda and continue to amplify this local and amplify this policy agenda to local and elected officials. And speaking of local and elected officials, we've also worked to build the leadership capacity of residents as they've participated in public speaking and community advocacy trainings. They've helped develop and lead presentations to their community, to local officials, to this community board, I think to this committee as well, and another subcommittee, and also to city agencies. We also have a resource utilization component of the project where we asked residents to let us know which services and resources in East Harlem were relevant to their needs and their opinions about these services. And following this resource identification exercise, residents actually compiled and designed an East Harlem resource manual. They've also now been trained in human subjects protection research, and they're now going to gear up to recruit 50 additional neighbors and friends to do the same resource utilization exercise that I just described. I should also note that adult caregivers shared that we couldn't do any of this work without the voices of young people, without integrating the voices of young people. So the NIAM team was really constantly looking for ways to bring youth alongside us as part of the project. And so all of these pathways and things I've noted are still the goal and focus of the project, but we had to pivot, of course, as a result of COVID-19. And as a NIAM team, we wanted to make sure that we were being helpful and responding and meeting the needs of residents, acknowledging that life has drastically shifted as a result of the virus. And so in terms of pivoting, we actually took time out to individually interview the residents that you saw at the beginning of the presentation. And, I'm sure many of these issues are not surprising to you because, many of our East Harlem residents are going through the same thing. But food issues sort of rose to the top. And then you can see here, followed by economic issues, housing issues, health and wellness, job loss, and just fears related to the virus as well came to the surface when we did those one-on-one interviews. And so one of the things that came, that blossomed as a result of sort of pivoting, we finally had a chance to integrate youth as part of the project. We partnered with Assemblyman Robert Rodriguez's office and Councilmember Diana Ayala to form a pilot of what we call the East Harlem Youth Advisory Committee or board, which we hope to continue with this initiative as well. And so we brought in youth to basically ask them the same thing, what they thought were issues, and we started with an assets frame from them as well, but we wanted to know sort of what they were going through within this COVID-19 context and before as well. And so we really got together with the primary goal of wanting youth to also inform programming and resources in East Harlem. And so we did some research training with them by helping them to understand what item design was. And so they did design a survey that was circulated to other youth in East Harlem. And we wanted to really assess the challenges and blessings that they were facing during COVID-19. And then we did some very preliminary data analysis, and we were able to find out sort of what youth were thinking in East Harlem and beyond. So we did not have a lot of time to do this, but certainly this was a very viable pilot in my opinion. And so just to highlight some of the dream themes, as we called it, for the youth, they uplifted, their hopes and dreams for, maturing in East Harlem, and they wanted equity in housing. I don't want to read the entire slide here, but you can see some themes actually that started to emerge that were synonymous with what our adult caregivers have raised as well. And so here I just have prepared a slide that shows you some of the assets that youth, I think we had ages 14 to 21 with us on the Youth Advisory Board. And so they raised community assets, and then they also raised some community challenges as well. And so what you'll begin to see here with this intergenerational perspective is that, sometimes there isn't as wide a gap as we think between perceptions between youth and adult caregivers. So we're excited to really continue this work and continue to build on sort of this intergenerational lens with the East Harlem Action Collaborative and the youth component. The second thing that I'll talk about, and this will sort of round out the presentation here, we've had an opportunity to do some food distribution at NIAM. Many of you all may know that our building is quite large on 103rd and 5th Avenue. And as a result of COVID, we have not been operating, at normal capacity. So because of the large building and sort of the residents uplifting that food insecurity was an issue, particularly for East Harlem residents, we were thinking and trying to be creative about ways we could partner with folks within East Harlem to get some food to residents. So our residents that live in Wagner housing development said that, in the beginning of COVID, there was a lot of issues with DFDA for whatever reason. The Wagner Center wasn't operational because it got shut down because of COVID. And so they said that 200 seniors were not receiving food. And so we had an opportunity to leverage our relationships with the Manhattan Borough President's office. Our Center for Healthy Aging had contacts as well, and our Community Partnerships and Policy Solutions team. Sorry, that's what CPPS stands for here on the slide. And and we were able to connect Wagner residents to Red Rabbit and City Meals on Wheels. And what was wonderful about this is that the EHAC resident leaders actually organized their own sort of food distribution setup. So all we had to do was get the food to them, and they sort of led the charge. They kind of got their neighbors together. They had the youth picking up the food, going up and down the steps, so on and so forth. So it was a wonderful just display of just community members coming together and doing what they needed to service each other. That was sort of our first food distribution experiment. The second opportunity we had to do food distribution was through a partnership with Scan Harbor. So I attend the meetings with Lou Zuckman's group, the Human Services Consortium. And so it was raised in that meeting that Scan at that time needed additional sites for food distribution. And so again, we volunteered our space for food storage and partner pickup. And so I think for a couple of months, Scan was able to come in and sort of take care of what they needed to do in terms of getting food again out to more East Harlem residents. Now, this third and final distribution experiment that I'll explain here is a little bit more robust. We decided to try this as well at NIAM since our building is still closed. Trinity Commons, which is a new nonprofit formed under Trinity Church Wall Street, has started a new initiative which they're calling Compassion Sites, and they reached out saying that they needed more compassion sites to get more food out to all of Manhattan. And so I said, we might as well try this as an experiment at NIAM since the building is closed. So we volunteered to be a compassion site. We have 3 sessions that we volunteered for. We've now successfully completed 2. So grateful that we've partnered with so many folks to help get this off the ground. We've partnered with Union Settlement. We've partnered with Liberation Cuisine, a social justice organization that is now transitioning to bringing food to residents. We have fed some folks in HUD apartments in Taino Towers. I have about 160 families that have been fed just by drivers volunteering, and the other half has been fed through our partnership with East Harlem Community Partnership Program and the families that they service. So this has become quite the operation. We're really excited that we've had the opportunity to do this, and we're happy to continue to do it. We have another distribution on December 17th, and families are able to sign up on a form that we've created at NIAM. And so this last slide is just, again, in relation to the resource utilization activity I shared earlier. So residents did an activity, shared kind of what resources and services they thought were really viable and relevant to their needs. And so what we're doing now is trying to amplify that to more residents. So we've actually taken this resource pad or this manual that residents have developed, and we have now made it into sort of a QR code key tag. We've just received those in the mail. We're excited, and we're going to be handing that out at a couple of community events that are upcoming. And also, like I said, residents have now been trained in human subjects research protection. So they're going to be the ones recruiting their neighbors and friends to ask them about how they feel about resources and services within East Harlem as well. I think this is my last slide. This was just to show you all, we started out sort of at our people graphic here at the top. We had the residents leading frontline workers, tech advisors, the NIAM team, and key decision makers. And we've actually expanded to so much more, so many partners. And really, to be quite honest, it's all the resident leadership. NIAM, we're just sort of the technical component. We're the facilitators. We provide the platform, but it's really quite beautiful to see what the residents of East Harlem have done. So with that, I just want to continue to give a shout out and thank the residents for their time. And also just want to uplift, we actually got information today that we lost one of our primary staff members to COVID-19. So this is a little bit of a rough time for me right now. And I'm going to stop talking because I'm about to cry a little bit, but thank you all so much for this time.
Oh, thank you so much. And we are so sorry for that loss. I did see that email. Second one that we've just heard on this Zoom. So first of all, thank you for your work. Thank you for coming to present, even in light of that horrific news. Thank you to Kimber and the team at the New York Academy of Medicine. You've always been just solid partners in our community, and we appreciate that. I was very eager to find out about the food distribution programs because I do think that they are very unique and very much needed. And the fact that it was a resident-based project that we were leading with so many different partners, I think is just notable and the type of work that, again, we should be elevating. So I did drop a link into the chat. Just as a reminder, I mentioned back at the September meeting that the East Harlem Community Alliance is gathering stories from our local service providers of organizations in terms of how they're stepping up to address the needs of our residents, how organizations are pivoting in the pandemic, and they are highlighting them on their website and vis-a-vis their social media so that all of our residents know that these services exist and how they can access them, but also so that people can learn about how to volunteer or how to donate to help support these efforts. So I did redrop the link to the East Harlem Alliance. It's eastharlemalliance.org. And then there's a specific section of the website where you can address making a submission to tell the story about your organization and its great work. I want to open up the floor for questions because there was 2 programs, the youth program, the food program. So first opening it up to the committee to see if they have any questions. Actually, excuse me, before I do that, Kimber, was there anything else that you wanted to add? You do have a few moments. You were very quick, Ms. Taylor. So thank you.
No, I just, our team is grieving today. We just received this news this morning, and so I'm just a little speechless, and I just want to thank Shania for really all the amazing work that she's done. She's being a little bit modest. She's really managing the entire East Harlem work and the East Harlem programming, and she brings a lot of creativity and a lot of different kinds of skills and experiences to the table, to our community. And I just, want to say that. Thank you, Nye.
Thank you all for your work and your partnership with CB11 in our community. So I'm going to first ask if there are any questions from committee members about the work at NIAM, about the youth program or the food distribution program or anything else that they're doing in the local community here. I don't see any questions from our committee members, unless I'm missing anything. Marlene, do you see any?
No, I don't.
Okay, I did see a raised hand from someone in the public. It popped up, but now it seems like it's gone.
No, he's still there, Zachary.
He says he has an announcement about at the end of the meeting, but Zachary, did you have a question related to the NIAM presentation?
No, I did not. My announcement is separate.
Yeah, thank you. I'm going to stay on topic to make sure we stay on time tonight. Is there any other questions or comments for NIAM at this time? Okay, our condolences from CB11 to you and the entire NIAM family, and we thank you for being here with us, and we so appreciate this work. Ms. Taylor, does Marlene have a copy of that presentation that you just did?
Yes, I do believe so.
Yes.
Great. I just want to make
I
sure.
gave that over to you all, Maya. You all as a committee have that as well.
Great. I think it was probably in that last attachment with the updates.
Mhm.
I don't know if you want to drop any contact information in the chat if you haven't done so already. We would love to just stay in touch about these programs. They sound amazing, both of them. And I also just want to recommend, if you haven't already, that you present to our Youth and Education Committee about your great work with the Young People's Advisory Council. I think that just blew my mind. I was just so ecstatic to hear about that. So thank you.
Thank you so much for the space, Nye. We really appreciate it.
Yeah. All righty. So we're going to go ahead and move forward on the agenda. So I wanted to invite, I believe Jenny is here with us. Jenny, are you here?
It's
So Jennifer is here from our community board and our committee. She also, I believe, sits on public safety and wanted to talk a little bit about the potential of an intersectionality working group. So Jennifer, the floor is yours to talk about what the issues are that have brought you here to us today and what you see as a potential possibility on how we can work together to address them.
I don't sit on public safety, but I think this involves public safety. So
Sorry. It involves public safety.
yeah.
And
Yeah,
I'm probably going to recommend that we partner with public safety. So that's probably why it's in my head. But
right, exactly. Yes, thank you. So I'll keep this really quick. I know we are really tight on time today. So I work at Mount Sinai, and one of the programs I work on is focused on East Harlem health outreach. And recently, my colleagues and I have noticed that many of the organizations we traditionally work with that focus on criminal justice and mass incarceration and the like are particularly struggling compared to some of the other organizations. And we know every organization at this time is really struggling. So we're noticing significant struggles with these organizations and also an increase in the need and urgency for their services because of COVID, especially as well. So I talked with Nye and Xavier last week about possibly coming up with a working group with public safety to see how, if at all, CB11 can support and elevate the needs of these organizations and really just better understand the landscape that they're working within right now, particularly given COVID. So again, I just talked to Nye last week, so I'm still working out the details. This is very much in the infancy stages of kind of an idea and possible working group. But I think the first step for me and for anyone else who's interested would really be to talk further with these community orgs. So a lot of what I'm learning is just anecdotal kind of emails or phone calls with people, but really to kind of take a deeper dive and to see what all of these organizations are experiencing right now. And I don't want to take up too much time, but I would just love if anyone is interested in working with me on this, or if you have contacts that you think I should talk with, please let me know. And in the future, I'm hoping to have a more robust update for you all. But thank you so much.
A little bit more, just so that everybody has some context. Could you just expand just a little bit more? So if people were going to consider doing a working group, what that would look like, what are the different committees and or topic areas that you foresee as intersection and impacting one another? So if you could expand, don't worry about the time, expand a little bit more. There are people here who are community board members, people who are, longtime residents, people who are new to the community, other service providers. So I think it would be good if you could just share a little bit of fuller context.
Yes, I'll try my best. I know some of it, again, like I said, is really just kind of different ideas that I've heard and have come about. And we literally just talked like the very end of last week. The big things we're seeing, of course, funding, which I think is across the board and something that is a lot more difficult to tackle. We're seeing organizations that are really having a hard time reaching the community members because of COVID. And then also just an issue with public safety and how these orgs can maybe help with public safety. I know I live up on 131st, and we're seeing a big increase in break-ins on my block, and it has been my block and the block over. And so I know we've been trying to work with these organizations to see how we can address this problem of safety without necessarily arresting people and sending them to Rikers or wherever and getting them involved in the system, because that we don't really want people going that route, especially during COVID, but we kind of need to address the public safety issue as well. So those are kind of like the real big things we've seen so far. And then again, with the organizations, with funding, just capacity and how they're able to operate when they already had like limited space and limited kind of availability for their services, but given COVID, what they're able to do and kind of how if maybe like supporting them and what they're doing can further trickle down and impact public safety as well. But again, super like infant stages, and I just wanted to kind of share with you all and have like a sounding board if anyone wants to talk and provide feedback or give me contacts, people I should talk with, or any issues that you're kind of experiencing that are similar to these as well, just to provide more kind of support and information moving forward, and definitely in the stage of just kind of doing some more research on this.
Thank you, Jennifer. I'm gonna give the floor over to our Vice Chair, Xavier, who brought this idea and opportunity to us to also share his comments.
Thank you, Nye. Thank you, Jennifer, for presenting. I'm sorry we all can't be in the same room. It's strange and interesting times we're in, but so be it. So quick things, love the idea. I think with the upper part of our district, it's always been very challenging. There are a lot of different things that impact the area. And before I get too far down the line, there is a 125th Street task force that was started some time ago by our previous speaker that has not really stopped, but it's been re-engaged. And COVID has only highlighted that. And I think where I see things kind of heading is that as we try to find the the trifold of issues we're being presented with, which is the human services issue, which is what you brought up, which are dealing with substance abuse, homelessness, these things that have taxed the area worse and worse. And then we have the public safety component, which is the fact that there's sheer amount of dealers that are up in those parts of the district, which is drawing more people to congregate. And I think at this stage, I think getting more information and that as we go down the path, and I think speaking with our colleagues on public safety and transportation, I saw the little chat from Jessica Morris, our VC on that committee. I think it would be good to kind of start to flesh this out, because and this is just a reminder for all the people in the public and for our committee members, a working group is something that can work to kind of guide things along. They can work with a committee or several committees, but if it becomes a subcommittee or a quote unquote task force, that has to be approved by the chair. So I think whatever, and I know this is the very infancy of it as during our conversation, I think we flesh out what the focus is going to be, but I think it can lead to informing our conversations as members sitting on the 125th Street Task Force. And I think that would be very fruitful down the line. And I think having that conversation also and as I said, like Nilsa, of course, will be involved in this process, but I wanted us to all have a healthy conversation as it relates. And this is where the work starts. So yeah, that is my general comment. And so I applaud you for taking the initiative and the gumption, and I think we'll open it up now to other members who'd like to discuss their thoughts.
Yeah.
And then from there.
Yeah. So just two quick things. I'll start, and I did see Eva and had her hand raised, so I'll call on you next, Eva. So Jen, thank you so much for coming to us. I do think that this also needs to be presented to the Public Safety Committee and its chair, Jose Altamirano, and its members for consideration, because as you said, it is intersectional. Many of these items overlap. So if you're talking about homeless in the park, what can we do, in the parks for programmings? If we're talking about what's going on 125th Street, there are other task force trying to address that, and I don't want to duplicate efforts, but I do want to create some sort of way, and we talked about this, I think, at my first Human Services Committee meeting, a way for us to stay informed about what's going on at the ground, so that when our members that are appointed to represent us on these larger task force have the right information from those on the ground and from our residents to be better informed in their representation of CB11 at these larger task force and kind of, agency level meetings. But I also, to the discussion that was already raised, want to make sure always that we are giving a voice to the voiceless, and that we are bringing local groups who have been working on these issues for years and are part of our foundation to the table. And I just wanted to suggest that there is a framework for some of this. There is a group called the Circle of Safety Group that is out of Harlem Hospital that meets once a month. And it is a kind of tapestry of different grassroots groups talking about the issues they're facing on the ground. So it is the leadership from law enforcement in the neighborhood, leadership from the community councils in the neighborhood, leadership from tenants associations in the neighborhood, leaders from youth organizations and family services in the neighborhood, et cetera. So it's a very interesting group that meets once a month, and I'm happy to connect you to the people who run that at Harlem Hospital and through CB10, because it might be something that we may want to mimic in CB11, especially knowing that things are going to change post-pandemic, and we may see a surge of some of the things that we're very much concerned about. So whatever we can do to be more informed and more supportive, whether it's getting our good partners more funding, making sure their funding doesn't get cut, learning what's working in other parts of our neighboring communities that we can replicate, and just having some knowledge transfer and dialogue, I think would be really supportive. A lot of people seem to focus on the negative in our community, and I've been here for 45 years, and I know that there's a lot of good going on too. And so we need to make sure that we elevate and celebrate and replicate that as well. So Eva, I'm gonna call on you next.
Thank you. I think Jan and Xavier answered a lot of my questions already. I was hoping to clarify this kind of scope of what this new group is aiming to do. But it seems that it would be useful, and I think learning from what other people are doing, gathering what existing groups are doing would be helpful.
Marlene, were there any other questions from committee members?
I don't see any more hands raised from the committee members. You have 2 people in the public that have their hand raised.
Okay, so Marlene, I don't know that I can see all of them, so I'm gonna, oh wait, now I see, if I click here. So it looks like Zach, I don't know if your hand was still raised from before, and then I see Jessica Morris. Those are the only 2 I see. Are those correct, Marlene?
Yes, Zachary is first and Jessica is second.
Okay, Zachary, I didn't know if it was raised from before, or is this in relation to Jennifer's item on the agenda?
This is in relation to Jennifer's item on the agenda. I have done a lot of work in intersectionality, especially when it comes to disabilities and when it comes to things like voting and race. So my question for you is, are you using healthcare as a base to connect it to other issues, or how are you approaching this working group?
Yeah, I would say I don't really have a great answer for that. So I brought in healthcare. That's just one of the many ways that, and then just some instances we've had on my street and the neighboring street were kind of how this was brought to my attention. So I think it's still kind of really for me to kind of figure out exactly how to go about this. I don't know if that answers your question, but I think it would kind of just depend on like now I was saying, I'm not trying to like recreate anything, but really just see what organizations that are already doing really great work in the community, like where they're seeing the holes in the support that they normally have or just have never had, and like we need support in these areas.
Okay, thank you.
Okay, Jessica Morris. Okay, Jessica says, unable to speak. Thank you, Jennifer, Chair, for taking up this important work with CBOs in the community. I will offer my question here in the chat. Kindly read aloud.
Jessica, can you press *6? Are you calling in? Are you on the computer?
She did put it in the chat, and I'm happy to read it if that suffices, Marlene, but we can give her a minute to see. She says she's on the computer, but it has no mic.
Got it. Okay, go ahead.
I'm going to go for it. Excuse me for one moment. So it says, how does this initiative complement ongoing, it's going too fast here. How does this initiative complement ongoing human services effort? I would add to Xavier's list of challenging issues, mental health needs also playing out on the street and being appropriately responded to. Public safety meets tomorrow. If you are interested in making a 2-minute announcement in the announcement section of the meeting, that is an open opportunity for all. The Public Safety Committee would be delighted to hear from you about this as it takes shape. So it looks like you've got an invitation and a date for tomorrow if you're available.
Yes, I think I should be able to attend tomorrow. You read the first part of the question there.
Just how does it complement other things that are already going on in human services, such as how does mental health play into all of this? So I know we talked about public safety, so she's kind of shifting the conversation away from public safety since we're human services into human services area of what this working group could potentially focus on.
Right. So, I mean, for me, I think I brought it up here because this is the committee I'm on, and also I think a lot of the organizations would be considered human services organizations. So that's kind of who I imagine really talking to on these first kind of just informational interviews and getting more information about what exactly is going on. Like I said, a lot of what's happened has been really like anecdotal stories and evidence just from me, you know, my friends, people that I live around, and just really seeing is it possibly that I'm just kind of seeing this because I have a closer eye to these things, or are these organizations kind of truly feeling what I'm noticing, and is there a need here? So as far as that, I think, you know, it's a public safety issue, and then there's a lot of human service organizations that are really the ones that are like Nye said, like have been doing this work for years, and just kind of talking with them a bit more.
Xavier, is your hand raised again?
Yes, it is. And I think just to kind of, sorry, your mic's not working. I think the next thing I would welcome Jennifer and to attend public safety and transportation. I will try to attend tomorrow as well. The week's packed, and I appreciate you raising this issue, Jessica, and always great to work with you. I think this is where many ideas begin. And we're starting that conversation, and we're filling in the blanks with what's already happening. And this is what we want is our board members being activated and coming up with ideas. And then we say, okay, this is already happening over here. How can we fill in the blanks and then enrich that process? And I think that's what we're seeing right now. We're just in the beginning, and all the public, thank you for being here and witnessing it in any way we can continue to be of service in this process as we vet how this will play out. You have our contact information. Please, Nye, once again, if you could just pop your email information in, and I'll pop mine as well. You have Jennifer's, and we're all working together very seamlessly. We were before, and COVID has forced us to go even deeper in those relationships. And so we just, if you have something that pops up, that's our purpose. That's our city charter mandate, is to work with everyone. We're not quite, I'm not prepared to say more on that. If I understand, I'm not really following the question just yet, but that's fine. Anyway, so we'll pop the information in the chat, and we'll go on. It's a shame she doesn't have a mic. So, all right. Thank you.
I'm going to go ahead. Thank you, Xavier, and answer Jessica. I think, Jessica, at this time, we really don't know much about what this could potentially be. In September, in listening to the community members' concerns about oversaturation and other issues, we talked about the potentially of creating an intersectional task force that had representation from the different chairs of our different committees, and then elected officials and grassroots providers. After discussion at that September meeting, because our elected officials were on that one, it was really a moment of pause to say, as we're just coming, back from the first wave of the pandemic, we do have existing task force that, as the new chair of human services, I wanted to allow to go to those task force meetings, get an update, also assess who was still here working on things, what new groups may have started, post-pandemic, or I guess I can't even say post-pandemic, but in the middle of this pandemic, to address these issues, and then let's regroup. So in terms of healthcare or health and human services component, I do believe that there's an intersection across all of the other topics and areas. It seems like there's interest in not doing a task force because it has a different representation in our community board, but possibly doing a working group where we come together and kind of gather best practices and information from those who are on the ground, and then use that to inform how we shape what happens on these other groups. And I would be in favor of that, but I, again, similar to you, Jessica, and others, would like some more information about what that would look like. So I would be in favor of supporting the creation of a working group, but I do think that it might need to come out of public safety, and have a human services component, maybe have a youth component, maybe have other components to it. And I look forward to see what happens next as we move forward. So I think that for this, as was stated, I would recommend that the next step for Jennifer would be to go to public safety and present this and see if they would like to take the lead on it, and then kind of help shape it and flesh it out a little bit. And then, we can revisit how we can all play a role to make that working group a successful working group and inform how we move forward.
Xavier, you have one more hand from the public.
Oh, sure. Please go ahead.
Moses, I believe his last name. Mark, you can speak.
Unmute. Hello, can you hear me?
Yes, we can, Mr. Moses.
Oh, good. Hi, it was great listening for the last hour to you and to Ms. Godot and Ms. Myers and all the incredible work that's happening in Harlem. to help straighten out people's lives. My question, I'm with the Greater Harlem Coalition, and we've been concerned in the neighborhood about oversaturation. And even though I listen to Mr. Godot talk about how many programs they have at the hospital and Mount Sinai coming in to try to help out with issues, there are so many people that are coming into Harlem that don't live in Harlem, that it seems to me that this is an impossible situation when I walk the streets of Harlem to fix. We're in a situation now where we don't want to put people in prison for drug offenses. And, it's a touchy time right now. We have COVID, we have so many problems right now. But with all the people that are coming here for help, especially if they're coming from out different boroughs, these programs for helping with drugs are supposed to allow people to check in and then go to work. But if they're being bussed in from other boroughs, then they tend to hang out here. And that's one of the things I wanted to bring up, and to see if there's any way that we can lessen some of these drug clinics and mental clinics and bring them to other boroughs where they belong.
Mr. Moses, can I ask you to just table the rest of the remarks for a moment? Thank you so much for sharing till we get to that item. We have not gotten to that item on our agenda.
Oh, I didn't know when it came up. Sorry, that's why I read
Yeah,
that.
it's okay. I put a note in the chat earlier when I saw all of the comments. It is the last item under new business is the possibility of having a moratorium on citing. So if you can just pause, I appreciate it.
No
I think
problem.
it's very timely. You just give us a few more minutes and I really appreciate everyone's patience.
Okay, no problem.
Sure. So any other questions from our committee members or the community? Again, this is not something we are voting on. This is just one of our fellow committee members coming to talk to us about how we can be working together more intersectionally to create some sort of working group that takes into account the grassroots groups working in these areas already and elevates what's going on, what are their pain points, what's working, what's not, and then can use that to inform other work that we do across the district. So definitely Human Services would be in support of that, Jennifer. I do think that it should be presented to public safety. I would love to encourage this idea of a circle of safety group that we could create that includes not only members of the community, but other service providers and leaders across the district. I also live in the northern part of the district and have been here for 45 years. And I do see that there is a difference in the southern part versus the northern part in terms of some of these issues, and be happy to work with you to make sure we address them. Marlene, is there anything else from our committee members before we move to the next item?
I don't see anyone's hands raised.
Okay, so I am going to move. Jennifer, did you have any other questions for me or for our group before we move forward?
I don't. Thank you so much.
Thank you and welcome, and I'm excited to have an opportunity to work with you. I also want to recommend, Jennifer, that you and Xavier should meet with Nilsa, who is the chair of our board. Any subcommittees, any working groups, any task force need to be approved by our chair and also reviewed by the executive committee. And so I just want to make sure as a new board member that you kind of follow the protocols so that we can have a successful effort together. Thank you. Okay. So I'm going to move on to the item that everyone's been talking about since we started, but it is considered new business. So new business is the last item. And before we go, we usually actually do old business before new business. So Marlene, was there any old business that we needed to address or any carryover from previous meetings that we need to bring to the forefront before we move to the new business?
No, not from my end. I don't see anyone's hands raised right now from the committee.
Okay, I am just going to raise one thing. It's not old business, but just a follow-up. I know that Isabel was here from the Manhattan Borough President's Office, and she was just reiterating the details for Test and Trace Get Tested Tuesday tomorrow. I do know that there was a representative from the Assembly members office on earlier. I didn't know if she was still here and if there was anything that she wanted to add, or if there's anyone from any other elected officials' offices that I may have missed earlier. Usually they present during the announcements, but I didn't see them at that time. I know Marielle was on. I don't know if she's still here.
I don't see Marielle.
Okay. Anyone from the assembly members or senators' offices? Okay.
No,
right.
I don't see anyone. It was just Isabel from Borough President's Office and Mary Ellie.
Okay. All righty. So
There's a hand raised. I'm sorry to cut you off.
Erica, are you from one of the elected officials' offices? Erica, are you from an elected official's office? Oh, she said that was a mistake. Okay, thank you very much. So we're going to move to new business. And I'm going to start I'm going to start with a conversation around a resolution regarding a moratorium on new service providers. I know this sounds very vague in East Harlem, so I'm going to narrow it down. We have repeatedly extended, I'm going to ask if you're not speaking to be on mute, only Marlene and I should be unmuted. We have repeatedly made requests for Oasis to come and present to us. And that was started by previous members of our board. It has continued with current leadership and our amazing vice chair, Xavier, who was the interim Human Services Chair, continued on that journey. We now have had access to information through FOIL from some of our amazing neighbors who have been diligently gathering information about the oversaturation and systemic racism that has contributed to kind of medical redlining, borrowing phraseology from my neighbor, Sean Hill, in this district. But as someone who's been here for 45 years, to me, this dates back to Robert Moses, as many of you have heard us discuss before, who incorporated racism into his urban planning. And I want to make sure that this group not only addresses this issue, but that we address the fact that we are here as a community board to be voices for the voiceless, that we need to address the fact that we do have members, neighbors, family members who rely on these services. I want to address the fact that we have many good neighbors, as you hear me and will continue to hear me say, who should not be negatively impacted because they have been good service providers. They are part of the fabric and foundation of our community. And I want to make sure that as budgets are cut post-pandemic, they remain fully funded and that our neighbors who need their services can. And to me, this is a bigger issue. This is not just about drug sites. This is about chemical dependency, drug rehabilitation, and the shelter system. So there's multiple issues into this conversation. We do know that our district also encompasses Wards Island, where there are several permanent shelters, and we know throughout our district there are several both permanent and temporary shelters, which contribute to some of the issues that we do see in the corridor. And some of that, I think, has to also do with the quality of these shelters and sites, some of which are really not equipped, particularly some of these storefront sites, to really address the flow that they have. Many have no waiting areas, et cetera. So people get service and they have to wait out on the street, or you see the effects of their treatment on the street. Others have numerous reports of the lack of safety at the shelters on Wards Island, and some people choose to be on the street rather than in the city or state shelter system. I also want to recognize that we are in the middle of a global pandemic and that the need for chemical dependency, chemical treatment, rehabilitation services, the shelter system will likely increase in the coming months to years, but that we need to make sure that we serve our neighbors first and then others outside of our community based on our capacity and the expertise that exists here. And for that, I'm still thinking about the fact that someone comes from China to East Harlem to get services once a year, is those kinds of stories that elevate the fact that we have some unique service providers here that we can't afford to be without. So I really wanted to focus this conversation around 4 key areas. I do not want this, and I'm going to use my chairman's privilege or chairwoman privilege, to be about bashing any of our neighbors or any of the service providers. I won't stand for that. I also want to recognize that while everything is on Zoom, there are many who might be unable to participate fully in this conversation. They may not have access to the internet. 50% of the people here in Harlem, based on a study done by the Comptroller's Office 3 years ago, do not have access. I bet you that number is even greater as people have to realize with budget cuts what they can afford and not afford. And we also know that people may be with their children or with their families or even working right now and not be here to present. So we need to make sure we have a balanced conversation around these 4 areas. Number 1, I believe that is within our right as CB11, representing the residents of CB11, to ask for an audit of all sites that exist. So for ACES to provide us with the listing of all sites, who the owners of the sites, who the providers are, where they get their funding, what the demographic is that they serve, what their capacity is at this moment. The audit would then be held, conducted by either the city comptroller or the state comptroller, depending on where the money comes from to fund those sites. That we ask for all sites within our district to be serving at least 50% or more of residents and patients from our district. That we would ask for a reduction over the next 5 years. And I think the number should be a 20% reduction. This is my recommendation, again, up for discussion. And that there be a redistribution of services so that we see more equity. And that goes back to the same thing that happened with the city council regarding waste transfer and sanitation stations. As you know, East Harlem CB11 has 3, which represent our neighboring community boards. However, in CB1, they were able to combine several waste transfer stations into a beautiful site that won an Architectural Digest Award. I'm not sure why they can't do the same here. I also want us to be mindful that we have a beautiful, historic, multicultural district, and that the quality of life here is being challenged by the oversaturation and systematic racism that has plagued us. But I do not want to be like some of these other districts that are kicking people out with nowhere to go. So I will not entertain that. We are a community of heart. We are a community that lends itself to taking care of our neighbors and our brothers and sisters and our seniors and those most vulnerable. So I want to make sure that we are really intentional and that we are caring for one another as we move forward. But I do think it's time that we force the hand and have a discussion about putting forth a resolution for a moratorium on any new services. So that means no new sightings. I want to be very clear. The first ask is no new, or not ask, the first mandate. I'm not asking anymore. No new sightings, step number 1. Step number 2, an audit of all sites that currently exist. And the reason why I say that is just a reminder, if it is a private storefront that is doing a lease, they do not technically have to come before the community board. And we are hearing that there are many brokers and leasing agents who are offering 3 months free and free renovations and all sorts of stuff to attract new service providers to our district because of our empty storefronts post-pandemic. That we want a listing of all sites, owners, providers, who they get their funding for, because there's a lot of places with all these different names. And when you go up the chain, you realize that they're all the same real provider behind it, who has multiple sites in multiple places with multiple names. And that's our taxpayer dollars funding these systems. That we have a better understanding of what the demographic is of the clients and patients, their capacity and expertise, that they must be serving 50% or more of people from our district. that we ask for a reduction of 20% over the next 5 years. And the reason why I say that is we don't know what's going on with this pandemic and the vaccine, and I'm not about to kick anybody out if they don't have another place to go. And that there is a more equitable distribution so that we are not bearing the burden. And I would also entertain that if over the next 5 years we are still bearing the burden, then we should get increased funding to our district to be able to do so, and increase funding and services. And by services, I mean all the other things you need to support this influx of people that comes into our community every day. So better transportation systems, buses, trains, cleaner streets, et cetera. And I would also entertain working with some of our local community partners to provide education and other programs to those who are here in the vicinity, whether it's because they're coming from Ward's Island, et cetera, but we need to find ways to help people be productive citizens if they're gonna be within our community. So I am going to allow people to raise their hands. I'm going to first go to our committee members. And then I am going to actually go, because I do see that one of our service providers who presented earlier is still here with us. So I don't know if they would like to raise a comment. And then I will go to the public. So I see that Xavier has his hand raised. So Xavier, I will go to you first.
Thank you, Nye. Do we have a draft resolution that we could put on the screen real quick?
We do have a draft of a resolution, but we just got some information from the Manhattan Borough President's office that she has requested we add to it. So we do not at this moment have a document that we want to share. We are going to incorporate, because she would like to work with us and support us on this. So I want to make sure we incorporate that before we share the language.
Okay, then if that is the case, if we're not going to be voting on a
We're not voting tonight.
Okay, then having that conversation, the next port of call then from a procedural point of view would be executive committee. That would be the next port of call with any kind of reso if we are trying to get this out the door quickly for this month before we go into holiday recess. Not to say we ever are off the clock, but yeah, I think having the conversation and we take notes to include if we do decide to make that decision, but then with full explanation if it does, because executive committee is the stopgap for these matters, so they understand that, you know, there was additions that were going to be included, so that way it's an easily explainer. Thank you.
Thank you. And we do have a draft. I want to thank Eva from our committee. I want to thank Marlene. I also want to thank Sean Hill and others for working with us on this early draft. And then I have been talking to several of our elected officials to get their input and buy-in, because this does cross both city, local, federal, and state boundaries. So I wanted to first make sure that these 1, 2, 3, 4, 5 items were items that we as a community and a committee could be in agreement on as part of the key tenets of this moratorium. So I'm gonna call on Eva next.
I just want to say I agree.
Sorry, I know that this is a very serious topic and I don't mean to in any way dilute the topic by laughing. I appreciate the way you presented that, Eva.
Yeah, and I also want to just thank Xavier for all the work that he's done leading up to this. And then of course, for Nye, for other work that you've done. I know it's a very difficult matter to communicate, and I agree with you that, you know, we certainly do not want to throw people on the street, and we really need to take care of these people who need help.
I agree. Anyone else from the committee? And if you don't mind, if your hand's not raised, I'm going to call on a couple people. Pastor Isaac, I know you're here with us. I'm going to call on a couple people that I know are near, this topic is near and dear and close to them.
Yeah.
Pastor Isaac, I just wanted to call on you because, as I said at the beginning, and as I always say, I want to make sure that we highlight and elevate and emphasize our good partners and use them as a model. And I don't want anyone to be jeopardized in this process. So again, I didn't say any expansions of current services. What I said was new, completely new service providers. And I want to open that up for you to comment, because I know that this is something that you and I feel very strongly about.
Now I would have said something if I heard something, but you articulated that perfectly. So I just kept quiet. Carry on. I think it's I think a lot of things, but I think when it comes to what can we actually do, I think what you outlined is probably the best thing that we should do.
Okay. I'm going to call on Robin. Robin, again, I'm just opening the floor as a committee member and someone who works in this field of, being a service provider. If you have any comments, suggestions.
Thank you for asking. I concur with my colleagues. I have nothing further to add. Thank you, though.
Okay, thank you. I'm going to call on some of our service providers who stayed with us because they are important partners and they work in this space. So Kimber, I don't know, I see you're still there, but I don't know if you're still on with us.
Hi, Nye. Yeah, I stepped away and I just stepped back, and now you're calling on me.
It's okay.
I'm trying to read the chat to follow the conversation, but
it's okay. And we can fill you in later. No worries.
Okay.
I'm going to go ahead and I'm going to, as a courtesy, open it up to Michelle. Your organization has been in this community. You are also within one of our longstanding public hospital partners. So I do want to open this up for comment. I want to make sure as we start to word this and craft this, and we want to get it in front of the executive committee so that it comes to the full board meeting this month, because we're concerned about budgets and shifting for come January. So I would love if you could comment on it. I want to make sure we word this in a way that doesn't harm good service providers.
Yeah, and I think there are like a lot of good points that you brought up. There's comments that people are talking about this concern of even, when there's clinics around, that there's more drug dealers and things like that. A lot of the reasons why is also there's regulations that are put by the state. So for instance, as a methadone provider, we're required to give methadone to our patients a certain amount of times. The pandemic has actually changed all of that. And that's something I think as a provider, we want to actually advocate more for these changes. So when all of a sudden our patients had to come in every single day to get medicated, we were able to coordinate where they could now take, medication for a month. This was great for the patients. This, for a lot of clinics, is actually, you don't unfortunately get, the money was less for us. So we actually struggled to sort of pay some of our staff. We were lucky to get a PPP loan that helped cover these costs. But what we did realize, and something that we would really like to work with OASIS and get support on this, is that these regulations don't always work for everybody, and forcing someone to come in every single day to get their medication is not good, and it's not necessarily great for the neighborhood as well. For instance, we had a patient who's doing amazing right now because they can come in once a month to get their medication, and they said, because it's true, when they walked around the corner, they saw a dealer, and they were faced with the challenge of trying to say no, and they were, and sometimes they caved. But because they weren't coming in all the time, they've been clean for, like more time than they've ever been. But we realize that this isn't our choice. Like we would, that this is the state regulates this. So I think that that's something that we're seeing with telehealth, and that, there were so many regulations, and funding for clinics wasn't always at the same level if you were doing telehealth, and really pushing that this can really benefit a lot of people by making sure that reimbursement rates are at the same, making sure that people don't need to come in every day, and still making sure that the clinics and the staff, and that they're getting supported financially to be able to make these changes. I think that could be really beneficial, and that might be changing, but it's definitely not, it hasn't happened yet. And I see, what this concern of people coming from other communities. My only response to that is there's a lot of stigma that goes around with addiction. And while I agree that there aren't enough clinics throughout New York City, for some people, even if they do have one in their neighborhood, it's still like they might not feel comfortable going into a space that somebody recognizes them or sees them going into the storefront. And so for them, it's easier to go somewhere where nobody would know where they are. And we might have people in East Harlem who are doing the same thing, and maybe they actually don't have the option of another area to go to. And so finding that maybe places, on the Upper West Side, I saw someone said it, Queens doesn't have a lot of places as well, but finding it that they can easily access the services somewhere else because they just might not feel comfortable, I think is really important as well.
Michelle, I think that is so true. And I thank you for raising that. I do believe that I know a lot of people in my work, I'm a forensic psychologist, by trade, people didn't want to go where, it's kind of the opposite of the bar, right? You want to go to the bar where everybody knows you, like the Gators, right? Where everybody knows your name and they're always glad you came. But when you have a domestic violence situation, when you're coming from a shelter, when you're coming to get support services, you may not want to go in your neighborhood. And so I do think we need to be cognizant of that. What I think our residents are concerned about is the people who come from Staten Island here and the people here who have to go to Staten Island. So there should be something that's complementary, that's, one district over or one neighborhood over, like how people from the Bronx might come here. And if need be, someone from here might have an option to go to the Bronx. But going very long distances, I think is a huge burden on a lot of people, especially during the pandemic. And also the fact that there are, based on, designated research and tried and true details that are available publicly in open data, there are deserts where there are no treatment facilities. And then there are places like East Harlem where we are completely oversaturated and don't receive any additional funding or support, even though we're bearing the burden of the entire city's, need. So thank you for that. But I think that that's an important thing to note, and we need to be sensitive to that. Okay. Marlene, are there any other committee members? Just because I see a bunch of people on in terms of our speakers and others, are there any other committee members who had their hand raised?
No, there aren't any hand raised.
Okay. Are there any other hand raised?
Yes, there's one hand raised from the public, Cecilia.
Okay. So I'm just going to give some guidelines to the member of the public. I see lots of your comments in the chat. I'm going to say to you two things, and I ask you to follow these two rules. First and foremost, this conversation is not about drug dealers at this particular moment. This conversation is about good partners and bad actors in our community. So what we are trying to do is craft a moratorium vis-a-vis a resolution from this committee that addresses mandating no new sightings of chemical dependency, drug rehabilitation and treatment, shelters in CB11. Request a listing, and that OASIS actually come to us and present, which I know Xavier's working on, but a listing of all of the sites, who's the owner, who's the service provider or CBO partner, where they get their funding, who they serve, their demographics, what their capacity is, and any other partners, because there's some other stuff going on that I want to understand. That they're making a commitment to serve 50% or more from East Harlem. We're asking for a reduction of 20% over the next 5 years and a redistribution of services across the entire city to make it more equitable. If your comment is about something that specifically happened on your block, to your house, to your building, you can continue to put that in the chat, but we are trying to get information on those items that I just outlined so that we can put forth and draft a resolution to be presented to executive committee. So I see two participants with their hand raised. I believe the first one was Cecilia. Cecilia, you can unmute yourself.
Wonderful. Thanks, Nye. It's a pleasure to meet you and to allow us a space to bring this new business that I see your committee has been working very hard on. So thank you for sharing all the details that you have with us thus far. I am a member of the 119 Block Association, but also a member of the Greater Harlem Coalition. I have worked with some of your committee members, such as Sean Hill and Eva Chan. We're all looking towards the same result, the moratorium. Some just questions or clarifications I had on. On the mandates, when you ask OASIS for who the providers are, where they get their funding, where are they located, just the overall details of the saturation in Harlem, I was wondering if it could be included, what their metrics for quantifiable success are.
Great. So I put outcomes on here, and I did not see that. So thank you very much. But yes, I put capacity and outcomes. It was a lot. And so, yes, I'm in agreement with you. I'd like to know how they're measured and or reimbursed, because one of the things I'm very concerned about is some of these storefronts seem like they're taking more capacity than they really have a space to handle, which is why I think we see a lot of people out on the corner. And again, a lot of these storefronts I don't feel have proper waiting rooms. I just, like I said, I have worked in this space for years through Mount Sinai and other hospital facilities in behavioral health. And, you need to have your space set up in a way in order to provide good service. And I don't think that some of these are. So thank you for that. I am in agreement. And yes, we have outcomes, one of the issues.
Right, because we, obviously Greater Harlem Coalition knows that healthcare is important and addiction is a disease. And if they are, doing the taking the initiative, right, to find treatment, just even that beginning step that they are getting the best treatment that they can have, so that they are held accountable and measured, right, that they are a successful place so that these individuals can be successful themselves within their treatment. So thank you for that.
Yep.
I
And
have
so
one.
I'm going to remind everybody that it's question and then response, and then we're going to try to not have the commentary so that we can get through everything. I don't want to feel like anyone is cut short, but I do want to make sure we get to those who have their hand raised. I'm going to take one moment because I know there's many people from the Great in Harlem group, and I'm going to take a chairwoman's point of preference, and I'm going to actually, if Sean Hill is still on, I would like to open it up to Sean to first thank him for all of his work and his partnership as we move forward through this process. And Sean, I just wanted to allow you just a few minutes to speak. If you want to just talk to maybe the top, 2 or 3 things that your group is working towards and would like to see as we move forward. Sean, are you okay to present? So we can't hear you, Sean. I don't know if you're still muted or. It says here that yes, he can speak, but we can't hear him. Yeah, we're not unmuting everybody, Maria. Thank you so much. We're only unmuting people as they are called upon to speak.
Oh, okay, I think I was just unmuted finally
Thank
there.
you so much. Yeah, thank you so much for your patience. Thanks, Sean.
Not a problem. I just wanted, first of all, echo what Cecilia said earlier and thank everyone on this committee for the incredible hard work that you've all dedicated to this process. Xavier, if you get Oasis to the table, I owe you not only one beer, I think I owe you multiple beers, because that has been a goal of many residents of East Harlem and many organizations in East Harlem for many years now, is to ask Oasis, which is a state-funded agency, to talk to the communities that its decision-making directly impacts. So that is huge. And I just want to say thank you, especially to Xavier, but really everyone else on this committee has done an incredible job. And at the Greater Harlem Coalition, we just want to reiterate that our goal is to have a fair distribution of these programs in all 5 boroughs, in all 5 communities, or pardon me, in all communities, because ultimately we want people, if they want to get treatment in Bay Ridge, to be able to get treatment in Bay Ridge. If they want treatment in Staten Island, they should be able to get treatment there. We just ask that communities like East Harlem not be oversaturated and bear more than their fair share, while other wealthier and frequently whiter communities reject these programs in their neighborhoods. Anyway, that's it, Mai. Thank you so much, and I appreciate all the work you have done so much.
Thank you. Xavier, I'm going to call on you, and then it looks like Maria Granville has her hand up. Xavier will go first, and then I will recognize Maria.
Thank you, Nye, and thank you, Sean, for the kind words. We've been working at it very diligently, and so have our electeds. I've obviously been a pain in their butt, which is where we are today, because obviously I think they see there's a problem, but also to express it is that there's a disconnect between the way the city and the state agencies come together, and oftentimes they understand aunt calling. So they understand our obvious rancor and what's going on. And I think we're trying to get them to sit down so they can actually witness it, see it firsthand. And obviously we're at a stage where we're incensed and no one wants to come before a firing squad. And that's not what we're asking. We're asking for them to come and sit at the table, and we're getting there bit by bit. So keep your fingers crossed, and I'll keep you updated. So thank you, Sean, for all your work, because it gave me some additional ammunition. And everyone here who's from the Greater Harlem Coalition, and all of our committee members, and everyone who cares about this community, we're doing the good work. And it's a very complex problem. And as Nye alluded to earlier in our many conversations, it is we're righting the wrongs of Robert Moses. That's what we're doing. A lot of this we can trace back to his actions as the quintessential power broker of this city. And if you haven't, go read the book. It's a huge wake-up call. And then read it again, because it'll put you to sleep the first time. Anyway, thank you very much. I'm going to leave you to it. Thank you.
Thank you. So next, I'm going to recognize Maria Granville. After Maria, I see that Todd Stevens, who's a broker in the neighborhood, also has his hand raised. Sister Maria, the floor is yours for a few minutes.
Hi, I'm not going to take a few minutes. I put my comments in the chat, and that is, as you are doing your resolution, can you include what they call harm prevention? And that includes needle exchange, crack paraphernalia distribution, and what we don't have and we really don't want, safe injection sites. So if you can include those, they are actually very, very important, because they feed into the treatment centers like you wouldn't believe. And there has been languishing in the state a bill to prohibit these sites from being sited within 500, and we'd like to say 1,000 feet from schools, churches, etc., just like alcohol. And it would be great if CB11 could throw their support behind that type of state resolution. That's all I had to say.
Thank you for sharing that with us. I'm in agreement. I think the committee will definitely consider the placement of these sites in relation to schools, churches, and others. I will take it back to the committee for us to discuss about harm prevention, needle exchange, and other items. Thank you so much for sharing with that. And just so everyone knows, we keep the chat and we're reviewing all of the comments that are there as we move forward. Thank you for sharing the bill number, Sedaria. So next I'm going to call on Todd Stevens. And Todd, once you ask your question or give your comment, I'm going to have one back for you as someone who works in real estate in our community. So please, the floor is yours.
Yes, I guess you can hear me?
Yes, I can.
Yes, wonderful. Thank you. So I'm one of the co-founders of our West 124th Street Block Association. I'm also on the MMPCA board, as well as Maria Granville and Sedaria. So my excitement is I'm just so happy that this is being put forward. And I'd rather just celebrate what you're doing and celebrate that something is actually happening. And I'm excited for this to actually just take its action in comparison to kind of making further demands upon it. And then I believe our community can take further steps after this is implemented. So I think that that's, oh, I don't know. Someone else is talking. I think that that's so crucial to just push it forward. I like to add, I'm so happy about a reference of lines out the door. I think all the facilities have this issue. I live on 124th Street, directly at the epicenter of all of these, methadone clinic problems. And there are lines out the door of every facility. And they all do have security staff. I'm in constant communication with, Mount Sinai Beth Israel, Harlem United, and Start Recovery. And they give me, a variety of excuses of why they can't do things that I think everybody would like them to do. And again, I just think it's so important to celebrate what's going on and be excited about it. And then we can take those next steps onward after this is put through. And I hope that CB11 does have a public relations person who is kind of sending out press releases about what it's doing, because it's kind of the best news I've heard all year.
So thank you, Todd, my brother. I appreciate that. And thank you for how you celebrate Harlem and the neighborhood with your work. I'm going to just digress for a moment and laugh and chuckle that CB11 does not have a press person. And it's actually something that I'm thinking about adding to the resolution, which is whereas Community District 11 has never had some of the PR savvy of some of our other neighborhoods, more affluent neighborhoods nearby, in order to draw greater attention to this issue and our oversaturation and systematic racism that has burdened our community. So thank you for reminding me to add a note about that, because I'm watching what's happened on the Upper West Side and in Hell's Kitchen as these issues pop up, and how quickly the media has a story, how quickly the lawyers are mobilized in those communities, and things change. I've been working in marketing, PR, and digital media for a very long time. And once this resolution passes, you better believe everyone will be talking about it for good or for worse. I just wanted to see if there's any other hands raised that I may have missed. Thank you, Eva. I have that note. Marlene, is there anything else?
No, I don't see any more hands raised, Nye.
Okay.
I think you were going to ask Todd, based on his real estate expertise.
Maria, can you not do that? That's why we keep everybody on mute, my sister. I will raise the question in a moment. Thank you so much. I appreciate it. I didn't forget. I've got all my notes right here. Before I ask my question, I want to make sure that we reiterate what we are going to be including in this draft resolution for presentation to the Executive Committee of CB11. First and foremost, mandating a moratorium on new sightings, meaning that city, state, federal, local, no one can issue any new sightings for any drug rehabilitation, chemical treatment, and or shelters. I think the shelter one is going to be a little bit tricky again post-pandemic. I believe that there's going to possibly be a rise in need for shelters and or drug and other facilities, but I'm going to do what we can to make the wording as strong as it possibly can be. The second is that we get a listing of all of the sites, who their owners are, their providers, landlords, and then I'll get to my next question, funding, demographics, partners, capacity, outcomes, or metrics, as Cecilia used, just in case they don't know what I mean by that. We'll draft it accordingly. That there is an audit of all of the sites that currently exist because they are funded by taxpayer dollars, either from the city comptroller or state comptroller, the same way they audited NYCHA, they can audit these sites. That any of the sites here have a commitment to serving 50% of East Harlem CB11 residents, that we get a reduction of 20% over the next 5 years, and an equitable redistribution of the current services. Todd, I have heard from two presenters at my first meeting back in September that are private owners of sites here. One is a shelter site and one is a treatment facility, that the brokers and real estate people are really focused on our neighborhood in the South Bronx, given what's happened post-pandemic and these storefronts closing and office spaces, closing or places going out of business, that the real estate community is offering special incentives for shelters and rehabilitation and drug treatment facilities to consider East Harlem, South Bronx for their placements and expansions. Todd, are you hearing that as well? I know
So
it's more residential, but I know some of these would be placed in residential residential spaces.
right. So I think what's gone on in the past 6 months, I mean, I have not done this personally, but I think that there is an enthusiasm for temporarily renting out spaces as homeless shelters, transitional facilities, etc. There are private entities, of course, such as the Mount Sinai facility. There's a private business that owns that building. I think that, as you know, we have 44 retail spaces that are empty on 125th Street from river to river. A friend of mine just closed their restaurant this past week, so I will try not to cry about that. And so I would like to add, as far as the, I apologize, to clarify what I'm saying is that basically, due to everything that's gone on this summer, defund the police, etc., we have this challenge that the nonprofits and the facilities, they're the ones most excited to achieve more space at this time, more than anyone, I think, in Harlem. And because things are affordable, and the private office, the companies, they are more still looking at Florida. They're looking at New Jersey. They're looking at, Connecticut, et cetera, in comparison to increasing their space in Manhattan, unless it's Facebook, Amazon, and so forth. I apologize. There's one more thing I'd like to add, and I thank you for the opportunity. What's fascinating to me about the Lucerne and about a transitional homeless shelter that we have on 124th Street, it's the big red building. It has 60 units of people inside of it. It is right next to Harlem Shake. And so the red building, were 60 people of varying situations, mental illness, prison, all the above, former criminals. These people provide, they do not give us any problems at all within this red building that is managed by the Jewish Coalition. They are very strict with their rules. They're very strict with their rules. And I was actually a volunteer overnight at a homeless shelter also that was also strict with their rules. What has gone on is, of course, we have facilities that aren't so strict with their rules, and the Lucerne, of course, is a good example of complete mismanagement. In comparison to this red building that, I have a 2 and a 4-year-old. We walk by it every day. I go into this building every few days to talk with them. They are 100% type A impeccable at this facility, and they give us no problems. The problems proliferate when there's mismanagement and carelessness in reference to what's going on the sidewalk.
So thank you so much, Todd, for that. I think one of the things we also probably should look into, and we're going to mute you again, Todd, just so that we can move on. Thank you for sharing, because I did call on you, so I appreciate the additional information. One of the things that we should also probably look into is 311 and other complaints and calls related to some of these sites. And I will put that as a sidebar, but something for us to look into as well. So Marlene, do you see any other hands raised of anyone who has not spoken yet before, or a member of our committee?
Yes, there is one hand raised from, I believe it's Phil Kelly, but let me find him. Yes, Phil Kelly.
Mr. Kelly?
One more person just raised their hand.
Who is that?
one
Yeah.
more person, Sidaria. I
Okay.
apologize if I mispronounced, but Phil Kelly is first.
Yeah, those will be the last two. Okay, Mr. Kelly, please go ahead.
Hi, can you hear me?
Yes, we can, sir.
Okay, thank you. Thanks for giving me some time. I've been a resident of Harlem for about 20 years and East Harlem for about 10 years. It's fantastic that we have this on the agenda, and I really appreciate the discussion. I just have one question. Why are we aiming for only a 20% reduction over 5 years rather than a fair share target? I mean, the city's recognized fair share as a valid measure of the siting of services, but failed to really do anything about ensuring that it actually happens. So why not have that as a target?
Yeah, Mr. Kelly, that was number 5, which was a fair share redistribution of all services to make it equitable across the 5 boroughs of the city. So
Okay.
that is there, but first and foremost, I believe that we should assist those who are currently in the system receiving services in our neighborhood and show them the same compassion that we would want to be served. And I don't think that the city is capable of changing anything within the next 12 months due to the pandemic, and we'll possibly see an increase of services. So item number 4 was a reduction of at least 20% over the next 5 years. I do not want to be one of those neighborhoods that says, okay, it's somebody else's problem, we're kicking you out now. Plus, I just don't think that it's possible. As someone who has worked for the city and someone who's worked in behavioral health, I think we need to be mindful of how people transitions and their circumstances. And again, that it's not just the rehab and those day treatment facilities. We're also talking about shelters and other facilities that have to do. And we do know that our district has a large number of students that are housing insecure or homeless. I think we're number 4 in the city right now, and we have other issues. It's not a one size fits all. So I want to make sure we are humane in our requests, that we set it up to succeed as opposed to fail. And as I said, we show the same compassion to others that we would want if it was our family members and or ourselves. So next, I think I have Sidaria, and I believe that that was it. Sidaria, my sister, the floor is yours.
You have me on instead.
Hello?
Yes, go ahead.
We know that Central Harlem is the home to Central and East Harlem, houses the largest methadone treatment facilities in New York City. And in 2008, CB10 established a resolution as well for the same type of moratorium that you're talking about. I can say that it did not make a difference because we know that since that date that they've established quite a few facilities since then. I'd like to know, what would the difference be? What can Community Board 11 do that maybe Community Board 10 did not to make that difference?
I can't speak for any other community board, and I'm aware of the Community Board 10. As you know, I go to both community boards since I live in the neighborhood on the cusp between both. One side of the street is Community Board 11, and the other side of my street is Community Board 10. I think that post-pandemic, it's another issue. I think post-George Floyd, it's another issue. I think that our city and our country is having a awakening and a reckoning of the fact that systematic racism exists, that systematic racism is a public health crisis, and that we need to address and finally right some of the wrongs that have plagued our society for a long time. I also believe, and this is just me speaking personally, I'm gonna actually take off my hat for a moment, that reading the issues that have surrounded the Lucerne on the Upper West Side and Hell's Kitchen, and the way that I have seen amazing people like our borough president step up, our Senator Brian Benjamin step up. I'm now seeing our Assemblyman Robert Rodriguez helping us to get this Oasis meeting. These are the things that wouldn't have happened 4, 5, even 10 years ago. I've been here for 45 years and I've watched smaller organizations. I've watched residents talk about these issues. The 125th Street issue didn't start when the Greater Harlem Chamber decided to write about it. The issues on 125th and other parts of our district have existed for years, and smaller entities have never had the political capital or the PR savvy that some of our newer residents and groups have, or some of our other neighbors in other communities may have. So I do believe that just like we probably aren't who we were in 2008, I know I don't weigh what I weighed in 2008. I don't think that our world and our community and our society is as it was in 2008. personally, if Obama was still our president, we might not be in some of the issues that we have in this pandemic. But given that it is 2020 going into 2021, I think if we're going to make a push in light of the activities that are going on the Upper West Side, down in Hell's Kitchen, in our own neighborhood, thanks to the great work of you and some of your colleagues, and some of the reckonings and awakenings that we've had as an overall society, now is the time. At that time, CB10, I know worked on it and put it forward, and we were happy when it happened. But I wasn't on CB10, and I'm here as chair of Health and Human Services, and I am rallying, my entire network of political contacts. We have a great vice chair in Xavier and a chair in Nilsa, who I think are very supportive of us having a balanced way that is respectful of our current community and its needs, but also mindful of how we move forward and the burden that has been placed on our community in so many ways. So I can't speak to what's happened before. I can only talk about where we go from here. And I like to under promise and over deliver, which is why I've only been a chair since September, October, November, and here this moratorium is on for discussion. So thank you, Sedaria, for that question. I'm gonna close questions for this moment. I'm going from the public. I'm gonna go back to our committee members for final comments on this. And so I'm gonna start with Xavier and then go to Eva.
Yeah, thank you. And to all our members of the public, thank you very much. We could have, your comments are very helpful. We could probably write several white papers on what happened from 2008 to now. I will say is that, and I have had extensive conversations on this with the resolution and everything. I will say that when not just the capital of politically where we have right now, but also I think taking into consideration what the economic environment was back then in 2008 and what the transition we went through and the impact that had with the political capital of then. So when you have property valuations and then a market crashing and but that's just one of many components. And so I think what we need from all of you who are attending, and I can tell because the attendance has been up increasingly so since the summer, since we've been virtual, is that as we push this resolution across the finish line and hopefully get it approved by the full board, we have elections coming up next year. And where we can most activate ourselves, and this is again, taking a very broad line, is that our city charter mandate allows us to take a position, and those that are in office they listen. And as they go into next year, more people are going to be listening. These issues are going to be taking front and center, which was different back then when it came to the city. So now is an opportunity to really elevate these issues, to push them forward, and to get people's attention even more. Not to say that they're not, but it's now hypersensitized and people are clued in. So let's use that to push what we desire to better improve all members of our community. So that's it. Thank you. I appreciate it. You've got my information in the chat and we're here to work together.
Eva?
So you see, we have enthusiastic public audience, so many people attending. So my question is, if you can name top 3 things the public can do to help you further this agenda, what would it be? I take Xavier's point that this coming year is an election year, and now it's time to act. Also, more people on Zoom, more people on social media. What can they do to help us?
So thank you very much for that question. I appreciate it. And I'm going to start, as anyone knows, I would answer. And I would actually take pride in asking everyone that's here. We have 55 people that have been on and, taking away the small human services committee and our presenters, some of which, would be impacted by this and serve in this space, is number 1, to take some time to identify the good service providers in this space in our community. As I started off my comments, we often have people, and I'm going to ask if you're not Nye Whitaker, if you could please make sure that your mic is on mute because I see several people who are from the general public unmuted. So I'm going to ask you to please mute yourself, otherwise we will. First and foremost is I'd like to ask everybody, particularly anybody who's been in this community 20 years or less, because I've been here 45, to please take some time over the next 2 weeks to identify the good service providers in our community. And I'm going to keep bringing them to our community meetings and presentations so that you can start to learn their names. You can start to learn what they're doing, that they're doing well, that you can start to understand that there are people here who serve 50% or more of East Harlem residents, that there are people who have been longstanding 40, 50, 100 years in this community who have amazing outcomes, who have low recidivism rates. And we need to make sure that we know those good players by name and can articulate what they do and how they help and assist, and to identify that they're not part of the problem, they're part of the solution. Second, I would ask that you guys continue the great work that you are doing to elevate and bring attention to this, because as I said, there are many who have fought this battle before and have been exhausted by the lack of support and the lack of attention that have been paid to this issue of oversaturation, to the issue of systematic racism that it has exist. And some of them sadly are no longer here with us. So we need to be a voice for the voiceless. And last but not least, I think we need to make sure that we stay focused as we message this to other committees that you may sit on, other groups that you may be a part of, that this is about the people and not profits. So we need to be mindful that yes, your property values are important, but we are a community of largely renters, not owners. And so I think that the property value conversation, though very crucial to those who own, needs to stay in the owner's conversation with other owners. And we need to be mindful that we are not isolating anyone who may be renting when we talk about this issue. So we need to talk about the issue of the quality of life, which is synonymous to all. And then use the fact that we're talking about people over profits in the larger scale of the money that some of these providers are making by over subscribing their services and by not being good actors, by setting up their sites in a way to humanely and ethically serve the people that are coming through their doors. It seems like a lot of people want to take a lot of people in, kick them right out, and have quantity over quality. And East Harlem is going to require quality of them. I think it's a new day and age, and we want to make sure, as I said, that people are served with the compassion that we would like to see for ourselves and our loved ones. And then last but not least, when this resolution does come out, I want to see everybody support it and come to the full board meeting when I'll let you know whatever meeting it's going to be presented at, and come and speak in support of it so that it gets passed by the full board. And that, you know, assuming that it does get passed, that you guys do sign up to put it out on social media and others, that there's a new day in East Harlem, and we would like to be treated fairly and equitably and respected as a community that is a long-standing cultural institution here. So with that being said, I am going to call for a motion.
Nine?
Yes.
I'm sorry. There's one hand up from the public. You can recognize that person if you.
Yeah, so I did say after Sedaria that was the last question.
Okay.
If anybody else would like to put anything in the chat, I did say that was the last two questions for the evening. Our meeting is usually only 6 to 7, and we have now gone to 8:30. So we are going to close for the night. You are welcome to put any other questions or comments into the chat, which is recorded, but we are going to adjourn. So I'm going to ask from the committee members if someone could please make a motion to adjourn. I'm going to recognize the first motion, and then I will call for a second. So can someone motion to adjourn?
Motion.
Oh, okay. Zachary, could you please put your announcement, because there was an announcement section earlier at the start of the meeting. Could you please put your announcement into the chat? I would greatly appreciate it. So I'm so sorry. I'm going to go back to the motion. Who was the first to motion? Was that Eva?
Yes.
Eva motioned, and then I'm going to ask for the second for the adjournment.
I second. This is Robin.
Okay, thank you, Robin. Zachary, please, there was an announcement section, an informational section at the start of the meeting on the agenda. If you could please put whatever your announcement is into the chat, we will add it to the minutes from this meeting, which will be shared with the executive committee and the full board. So your announcement will still be public information. And those minutes are then also posted online at the CB11M website. So we are going to call this meeting to a close. I thank you all for your patience, for your time, for your passion, and for your hard work. We will be drafting a resolution to present to the executive committee and circulating it also to our other chairs that overlap in this particular area for their support as well. And again, once I know what the next step is, I will share that with everyone so that you can know when and where to appear to show your support. Thank you, everyone. Please have a great night.
Could we, real quick point of order?
Sure.
Did
I'm
we
sorry.
call all those in
Point of order.
favor since we have a motion for adjournment, please?
I'm so sorry, Xavier, what did you say?
We have
You
a
have to
motion
call for the roll because you call for a motion. Yeah.
I'm so sorry about that.
It's
Can we
okay.
just do like a verbal, like yay, nay for this or no?
Through acclamation in this instance, we can, yes.
Great. So I'm going to do, I apologize. We had a first and a second for a motion to adjourn. I'm going to ask if we can do a vote by acclamation. So all those in favor of adjourning from the Human Services Committee only, if you could please unmute. All those in favor of adjourning, can you say aye?
Aye.
Aye.
Any any nays? Any abstentions? Thank you, Marlene. Thank you, Xavier, for the reminder. The meeting is now adjourned.
Thank you, everyone. Have a
Everyone
good
for your
night.
patience and your passion, and have a great Monday.
Happy holidays.
Holidays.
Holiday.